Hello, my name is Marissa Ruiz, and my project will be investigating demographics and the insurance-based disparities in GLP-1 treatment access for type 2 diabetes patients. Imagine someone you know deeply has been struggling with managing their type 2 diabetes. They regularly schedule their doctor visits, take the correct dosage of medication, and even try dieting, but nothing seems to improve their blood sugar levels. Their doctor prescribes a GLP-1 in hopes that your family member's blood sugar level decreases, but they get a message from their insurance that they are not going to be covering the medication cost. This leaves them with a high out-of-pocket cost and vulnerable. The reality. If the patient chooses to pay their deductible, depending on their insurance, they'll have a high out-of-pocket cost, which can lead to financial struggle on other payments that they may have, and overall worsening health outcomes due to the financial stress. If the patient chooses not to pay their out of pocket costs, they are left with no new medication, stagnant in their illness management, and vulnerable to worsening health outcomes as well. My question is, among adults with type 2 diabetes, how does insurance type, Medi-Cal versus private insurance, government assisted or privately funded, compared to patients with alternative insurance types affect their access to GLP-1 treatments? Through my experience working with the residents from the UCI FQHC in Santa Ana, I will be analyzing the electronic health records of Orange County to determine insurance type and patient demographics to overall determine if insurance is the only limiting factor in accessing GLP-1. With assistance from residents, I will also be analyzing prior authorizations rates of patients who initially get denied coverage from their GLP-1 treatments. I will also be looking at retrospective data from the study the Helios Lab has done called Mi Propio Camino. This studied medicine adherence and blood pressure management to determine if patients also had difficulty accessing their treatments. Over 82% of the adults in the United States with type 2 diabetes are clinically eligible for GLP-1, but only 43% have access to this revolutionary treatment. Investigating this problem can bring attention and access to patients who need it most, regardless of insurance type and background. These results will bring awareness and hopefully bring change to the healthcare system to make medications accessible without determinants. With this topic being very new to the healthcare system, I'm also open and looking for individuals interested in collaborating or assisting with the research of GLP-1s and the accessibility of the treatment. Thank you for your curiosity.